Good afternoon. I'm Cookeville Mayor Ricky Shelton.
And I'm Putnam County Mayor Randy Porter. This is our COVID-19 coronavirus community update for Tuesday, May the 5th. Today, as of 2 p.m., our total number of confirmed positives in Putnam County is 160, which is 21 more than yesterday. Of the 160 cases, 89 or 56% of those have already recovered. Our recovery rate in Putnam is much better than the state average of 46%. We also have had 5 deaths, all of which were from Signature Healthcare. So let's break down our numbers. In the past week, we have had 41 additional positives, which is not very good. It should be a strong reminder to you that the virus is still out there and people are still getting sick with it. We have been trying to prepare you for this for the past 2 weeks. As the governor's restrictions are being eased and as more people are getting out and going back to work, there are going to be more positives, especially when you take into consideration the large number of people we are testing in Putnam County. At the health department's drive-thru alone, 2,878 people have been tested since March 19th. 186 were tested just yesterday alone. Just remember, testing is a good thing. The more people we test, the more people we find that have the virus, and they are put into quarantine, so they cannot infect anyone else. Also, we're doing a lot more testing compared to other counties our size and even several counties larger than us. When you look at basically 80,000 people in Putnam County, and we have tested at the health department alone 2,878, that's 3.5% of our population that we have tested. They may sound like a small number, but when you look at a Davidson County or Shelby County, they have both tested less than 3% of their population, which makes our numbers look pretty good. Also remember, those are just the test numbers from the health department and do not include what has been done through private labs. Our drive-through testing continues to be available at our health department on County Services Drive and is open Monday through Friday, 9 a.m. to 3 p.m. If you want to be tested, just drive by. They are testing anyone that wants to be tested, regardless of where you live, and please remember the test is free. We encourage you to go by and be tested if you're concerned that you may have the virus or just want the peace of mind that you don't. I want to take a moment and say a special thank you to all the health department professionals and National Guard who have been working on the front line during the testing. The other counties in the Upper Cumberland that have confirmed positives are Cannon County has 12, Clay County has 5, Cumberland County has 84, DeKalb County has 25, Fentress has 5, Jackson County has 7, Macon County has 53, Overton County has 10, Smith County has 23, Van Buren has 2, Warren County has 8, and White County now has 15. As you can see, several of the other Upper Cumberland counties went up today also as testing expands statewide. Again, Putnam County has 160 confirmed cases, which is 21 more than yesterday. Mayor Shelton?
Thanks. We've said all along to please listen and follow the directives and take personal responsibility, heed the guidance from experts, and use common sense so that you can protect yourself, your family, and everyone else. The fact is, we all still have freedom to follow directives or freedom not to, and potential consequences of our actions. Everyone has the right to their opinion and beliefs also. We must manage and mitigate health and safety of our people while we open back up our economy and businesses and get our people back to work safely. As things continue to open, remember, you still have the freedom to choose. You can choose to shop there or not. You can choose to eat there or not. If you don't think it's safe or you don't think the location is being socially responsible, don't go. Or if you want to avoid crowds, then that's exactly what you should do. Stay home. Something else to remember. There are almost 80,000 Putnam County residents. Every one of those folks live in a house or apartment with someone who has gone to the grocery store multiple times over the past 7 weeks. My point, we've not had an overwhelming infection of people or impact on our hospital like that was predicted. 160 total cases here. That's 0.002% of our population. I'm not saying this to minimize it, but to share hope and perspective. So if we can do it in the grocery stores as responsible people and responsible business owners, then we can do it in all the other businesses if we apply the same common sense principles. I'm optimistic, but we know this is going to be with us for a long time, and every day we will have more positives as we test more. Again, you don't have to go out. You can stay safe at home if you want. That's up to you. Governor Lee has issued several executive orders opening back up parts of our economy. We can only report what we're getting from the governor's office. I know there are lots of questions, and please realize we don't have all the answers either. We can only go by the information we were being given. Please remember the governor issued the executive orders to close the businesses that he did, and so the governor is the only person that can now open them back up. Despite what you may have seen or heard from other surrounding counties, no city or county mayor has the legal authority to overturn a governor's executive orders. So according to those guidelines, restaurants, retail, and fitness facilities are now open at 50% capacity with extensive safety guidelines. Barbers, beauticians, nail salons, tanning, and massage therapists, along with dental offices, will open tomorrow. If you have specific questions, you can always call the governor's office at 615-741-2001. As far as the city, the governor's orders list areas that should continue to be closed to the public at this time. Therefore, the following leisure services facilities will remain closed to the public, except by individual appointment until June 1st. That's the Performing Arts Center, the History Museum, the Depot Museum, the Cane Creek Rec Center, Cane Creek Gymnasium, Cane Creek Sportsplex and Youth Sportsplex, and the Parkview Ball Fields. City parks have remained open for pedestrian entry throughout the shutdown. Now, the drive-through gates at Cane Creek Park, Ensor Sink Natural Area, City Lake Natural Area, and Parkview Skate Park will be opened again on a regular schedule of opening and closing for daily use. All playgrounds, including the Heart of the City Playground, will remain closed and off limits to park goers during this period. Also, the Dogwood Park Fountain will remain off to avoid attracting large crowds to a condensed area of the park. Now let's get an update about Cookeville Regional Medical Center from CEO Paul Korth and Dr. Mark Pierce.
Thank you, Mayor Shelton. Thank you, Mayor Porter, for allowing us to come today to speak about what's going on at the medical center. We've had a lot of activity over the past couple days at the medical center. Just to give you an update, we have 10 positive COVID inpatients in the facility right now. We have a total now of 26 positive patients that we've taken care of over this pandemic period. We only have 3 medical center employees that have tested positive, and all of those employees have been through the quarantined time frame and are all back to work. As I said, this week's been a busy week. Yesterday we started elective surgeries back at the medical center. So as we gradually start to open back up our medical center, again, please be patient with us. We may run into some obstacles and we may have some things that don't work out just as planned. But again, we are trying to gradually open back up the facility and get outpatient surgeries started this week, along with some other outpatient testing, and our other outpatient areas have also opened this week. Next week, if this goes as well as has gone so far, we will look at doing some additional type of surgeries, such as inpatient surgeries, those individuals that need overnight stay at the medical center. A couple things to point out and remind individuals: it's still very wise and very smart to wear masks. We have started all of our employees at the medical center in all of our areas, especially in our common public areas, of wearing masks. Again, our employees are going to be wearing masks. Our staff on the floors are going to be wearing those surgical masks. Cloth masks are acceptable now to wear in those public areas, but they're not acceptable in treatment areas. And we will continue to supply our employees with the proper protection equipment that is needed. One other thing I would like to note for those individuals, and the numbers are up today and a little bit this week on testing. If you have tested positive, the best thing to do is to quarantine yourself. You must remain isolated through this time period. Dr. Pierce will have a lot more to speak about that, I'm sure, in just a minute. But that is one of the most important things that the individual can do, is quarantine themselves, stay away from people, and that is the way that we can stop this spread. This is going to be a joint effort by everybody in our community, and we need to do that in order to continue to have the positive numbers being reduced that we've had over the past several weeks. So with that, I'll ask Dr. Mark Pierce to come up and speak a few minutes. And again, thank you for everything that you're doing.
Thank you, Dr. Korth, and thank you, Mayors. Appreciate the opportunity to come back and just say a few words. I would like to really stress one thing, and that's as we open up, this virus certainly is not gone. I think we all understand that, and it is going to be present, circulating in small numbers. So it's still very, very important to keep the social distancing. I wanted to let you know a recent trial, recent study that was done that looked at exactly when the virus is transmitted. And it turns out that the virus is transmitted very early in the course of a person's illness. And a person is most infectious. They have most infectious virus present in their nose and in their respiratory secretions just before they become sick, and that day or day and a half before they actually become sick, and in the first 2 or 3 days after they become ill. We know that they have high titer of virus then, and that's the reason to wear the masks. The masks are not to protect you. The masks are to protect people that you come into contact with, because as you circulate more, some people are going to come down with the virus, and they will begin to spread that virus before they even realize that they have it. So you wear that mask, even a cloth mask, any covering that you have that will decrease your respiratory secretions from getting in your surroundings is really good. If you go to the grocery store, there are a lot of allergens out there. You might be coming down with COVID. You may not have any symptoms, but an allergen may make you sneeze. And when you sneeze and you blow your respiratory secretions all over somebody's bottle of ketchup that they come along behind and pick up after you. So think about that. That is really important. So you wear that mask, even if you feel like you're perfectly well, because you can't tell if you're coming down with it. And so the reason is to keep you from spreading it to someone else. And the last thing that you want to do is to be healthy and be careful, but carry that home to someone who is vulnerable. And still, elderly people, they've shown very clearly, people over 65, people with coronary disease, heart disease, people with congestive heart failure, people that are smokers, and people with lung disease. Those are the ones that are mostly at risk. And so it's really important that if you have someone like that that you come into contact with, that you wear your mask so that you don't spread that to them. I think that's the most important thing that you can do, and I'd really like to stress that. Appreciate the opportunity to kind of try to ram that down your throat. Thank you.
Thank you, Dr. Pierce, and thank you, Paul Korth, for everything you're doing at the hospital. On our county facilities and reopening, currently our plan is to reopen the county offices next week. This is tentative, however, and we will be making a final decision and let you know for sure at Friday's live update. Until then, we continue to ask everyone to use our online services, drive through and drop off boxes as much as possible. If you need to come to one of the new county offices, please call that office for an appointment. You can go to our website at putnamcountytn.gov for office phone numbers and online services. All of our sports facilities and community centers will continue to be closed through the month of May. We continue to remind about our tornado cleanup. We're very close to being finished. This week will be our final pass for the cleanup. The cleanup crews plan on being finished this Friday, weather permitting. If you own property in the tornado damage, we need to get your debris out to the county right-of-way by the street in the next 2 days so we can finish the cleanup process. I also want to remind you to fill out your Census 2020 form. You can do it 3 different ways this time. You can mail it in the form, you can go online, or you can fill it out at 2020census.gov, or they do have a phone number you can call to do it by phone, 844-330-2020. Currently, Putnam County's return rate is 60.3%, which puts us at 12th in the state and higher than the national average of 56.6%. So thank you to everyone that has completed your census form. If you have not completed your census, please do so, as all of our federal and some of our state funds are based on the census count.
True.
Mayor Shelton,
Yeah.
I think we have another guest too.
We do, but it's really easy on the census, and literally you can do it online in like 5 minutes. So please do that.
That is the easiest way, but if you don't have internet access or a computer, you can always call or still mail it in the old-fashioned way.
This is a ranking we'd actually like to move up to the top, unlike COVID tests.
Yes.
So we would like to be first in the state in getting our census back. So if you could do that, that'd be great. Now, we also have another guest. We have Mr. Lee Rooney, the CEO of Signature Health.
Thank you. I appreciate it. Thank you, Mayors, for your continued efforts. Thank you for allowing me to come back today and speak to some of our numbers. Hopefully today I can share some good news. Previously, as was reported, we did have a total of 51 cases at our facility, 32 being patients and 19 being employees. I can happy to report that as of today, out of 51, 37 have been cleared. That is 18 employees and 19 patients. And by cleared, I mean that they have gone through the quarantine process. They've had 2 negative tests. Our patients have been moved off our COVID unit and are now back in our general population. And 18 out of our 19 employees are back to work. That leaves 8 of our patients from the beginning that is still testing positive. I'm also happy to report that 7 out of those 8 are not showing any symptoms at this time. We're attempting to retest. Unfortunately, tests still show up as positive, even though maybe they've gone a week to 2 weeks. They're not having any symptoms for that length of time, but some of the tests are still coming back as positive. But we're working with them. We're working with the families. We're trying to get them cleared up and off our unit as quickly as we can. So that's a good thing that we're reporting on that. Also, we've not had any new cases for employees in the last 30 days.
Wow, that's great.
And from a patient standpoint, we've not had any new cases in 27 days. I attribute that, I think, to the quick action that the Department of Health worked with us on back on March 30th. When we pushed to have mass testing at our facility, that was early on when we had just a handful of cases, and we felt the need, knowing our population and how quickly this spreads and how at risk our population is. We asked for that mass testing, and I think it's because of that we were able to quickly identify exactly what we had and maneuver those patients in a location on our COVID unit that has minimized and basically eliminated the spread within our facility. We're still following strict CDC guidelines, still lock down our facility. The elders, the patients, the families understand all that we're doing. We're in close contact with them, so we're happy to report those things. Things that we're seeing from a recovery standpoint on our patients, we've had quite a few that said that they've had loss of taste and loss of smell. And anytime you have an illness, especially like the flu or something, you just don't feel like eating. So we're monitoring closely their weight, their intake, their fluids, and we're trying our best to give them what they like, what they want, meaning special orders. We've gone and ordered special items for them, the things that they feel like eating, feel like drinking, just so that way, whatever we can give them, we're trying to give them. We purchased televisions, radios, things to kind of break up the time of being quarantined in their room. Nobody likes to be quarantined, but we're trying to make it the best possible situation for our patients.
That's great.
We're keeping in real close contact with our families, and our families have been absolutely wonderful. They've been understanding, supportive. Can't say enough about them. We actually set up a hotline number early on, and this hotline number was designed for those families who had patients that tested positive, and it allowed them to get daily updates on the condition of their loved one, and so they could call and get that information to know in real time what is going on, and because it's hard when you can't visit your family member.
Absolutely.
And so this also allowed us to give the best care possible to the patients themselves. So we're not on the phone in the facility dealing with the questions, which are important. We allowed that to be done offsite. So that has helped considerably and allowed us to give the type of care that we need through our nurse practitioners, through our doctors, our infection preventists, anybody and everybody that we could get to be on that unit taking care of those patients. So my staff, not only the ones that are on the COVID unit, but elsewhere in the building, they've been fantastic. They're caring, they're committed, and they're courageous. They fight every day. They show up every day, and I can't speak highly enough about who I get to work with every day. So I thank them tremendously. Also wanted to say that I applaud the recent announcement of Governor Lee and his recommendation that nursing facilities across the state will be fully tested. It is something that I feel is obviously important because that's what I pushed for back in March, knowing our population. But testing wasn't readily available as it is now, so they're able to test all facilities, all employees. I think we're going to see numbers increase among the states. Hopefully not any in this region, but it won't be a surprise because as we know from my facility, we had approximately 85 to 90% that were asymptomatic. Still were asymptomatic, but still tested positive. Right. So We may expect that some of our positive numbers will increase as nursing facilities in this area and across the state are tested fully. So, but we applaud his efforts in doing that. We feel it's important. We're taking care of the most sick and frail elders, and we want to make sure that everything possible is done for our population.
Absolutely.
So I just appreciate the time to come out today to share this good news. Hopefully we'll continue to share good news with you. If you need me back, I'll be more than happy to do that. So
Absolutely.
thank you.
Thank
Appreciate
you,
it.
Lee. You're welcome anytime. We appreciate what you did, and there's no doubt in my mind that Lee set the standard for nursing homes and healthcare facilities in the state, and now you're seeing the governor follow his wanting to test everyone in his facility, and I think there's no doubt that lives were saved by him asking for his whole facility to be tested. And I think it's also kind of eye-opening that 85 or 90% of the people that tested positive had no idea they even had the virus or had any symptoms, and still don't.
That's right.
So that tells you that wearing these masks out in public is a safety precaution that everyone should be taking, especially when you're going into stores and crowds, Mayor.
Yep. So as we close, I read this and I wanted to share it. I think it's pretty pertinent. I've heard people say that we're all in the same boat, but it's not like that. We're all in the same storm, but not in the same boat. Your ship could be shipwrecked and mine might not be, or vice versa. For some, quarantine is optimal, a moment of reflection or of reconnection. For others, this may be a desperate financial and family crisis. For some that live alone, they're facing endless loneliness, while others, it may be rest and time with their family. Some may be bringing in more money to their households than they were working. Others are working more hours for less money due to pay cuts or loss in sales. Some families receive stimulus money while others families didn't. Some want to go back to work because they don't qualify for unemployment and are running out of money. Others want to tattle and report those working and shopping in stores who aren't doing what they think they should be doing. Some have faith in God and expect miracles during this 2020. Others say the worst is yet to come. So, we are not all in the same boat. We are going through a time when our perceptions and needs are completely different. Each of us will emerge in our own way from this storm. It is very important to see beyond what is seen at first glance, not just looking, actually seeing. So remember, we are all on different ships during this storm, experiencing a very different journey. We are in the same storm, but we're not in the same boat. So please continue to utilize precautions to protect yourself and others. Be kind and supportive to one another. Wash your hands, utilize physical distancing. When you do go out, make reasonable, educated, common sense decisions. Now that many businesses are open, we must change some habits so we can stay physically healthy. But remember, if you don't want to go out to a place that's open, you have the freedom to stay home and be safe there. For the most up-to-date COVID-19 information, links, and resources, you can visit bettercookeville.com. Let's continue to pray for our country, our healthcare workers, all of our businesses and employees, and let's choose faith over fear. God bless.
Also, regardless of what the governor reopens, we must keep doing everything we can to fight this disease. Just because things are reopening doesn't mean you need to let your guard down. As our testing continues to show, there are still people out there that have the virus, and you can still become infected. The last thing we want is for everyone to get out and do too much, too fast, and our numbers take a big spike. I think today is a perfect example of how easy that can happen. If you don't feel safe going out, please stay at home, especially if you have health problems that make you vulnerable. As things reopen, we need to continue to do the things we've been doing for weeks now. Social distancing, washing your hands frequently, and wearing a mask. As I watch people going in and out of stores in town, I see very few people wearing a mask. So if you don't feel comfortable going in some of those stores, then don't go. Make good judgment decisions based on what's best for you and your family. Just to be blunt, you don't need a government order to tell you what's best for you and your family. We have continued to say we will get through this, but everyone has to do their part. It all comes down to each one of us taking personal responsibility and making good judgmental decisions. A lot of you are doing that, but there are some that are not. If you were watching Governor Lee's press conference this afternoon, he announced today that the local health departments will be issuing free cloth masks to all citizens in the state of Tennessee. The Putnam County Health Department mayor will be issuing these masks at the Putnam County Fairgrounds, working in conjunction with our emergency management beginning this Thursday. They will issue these each day, Monday through Friday, from 9 a.m. to 3 p.m. We will be putting out maps and more guidance on how to drive through the fairgrounds later today.
Yeah, and so just again, the health department, it's through the health department, but it's not at the health department. So we don't want people to get confused and create more, because at the health department is the testing. At the fairgrounds, through the health department and our local EMA, will be the distribution of these cloth masks.
Yes, from the governor's office.
Correct.
They're the ones that I think they've ordered several millions of these. Maybe
It's almost like a sock material. It actually says Tennessee TN on it. So there you go.
Just remember, these will be at the fairgrounds starting this Thursday. So please don't be calling the health department before then asking, can you come by and get a mask? We will have these at the fairgrounds starting Thursday.
There'll be signage, so direct you in. You'll drive in. You will roll down your window, and you will be handed these packages.
And remember, if you have more than one family member in your family, if you say you have 5, if you will tell them that, they will give you the number of masks at request, so you don't have to bring the whole family in the car.
You
to
do
get your
not.
mask.
And if you have an elderly relative or neighbor or friend, you can pick up for them. But now let's all get real. Don't hoard these. Get the ones you need, one for each of your family members. For an elderly family member or an elderly neighbor or whatever that is, and then
Yeah. And these masks are washable, can be sanitized, so you can use them over and over. One size fits all. This came down as a directive from the governor's office today, and as we said before, we'll make sure everybody understands, you cannot pick these up at the health department. You will have to go to the fairgrounds. 9 a.m. to 3 p.m. starting this Thursday, and it'll be Monday through Friday each day, 9 a.m. to 3 p.m., not on weekends.
Correct.
Just Monday through Friday. Mayor.
that's right.
So if you have any questions, you can feel free to call the governor's office. We gave you that number earlier. We will be putting out more information on our website and on our Facebook pages about the mask and the times and maps and so forth about how you will drive through the fairgrounds to be able to pick them up. Mayor Shelton and I will continue to do live updates to keep you informed. Our next update will be Friday. That's this Friday, May the 8th at 4 p.m., unless something urgent should come up in the meantime. Please continue to keep our community leaders in your prayers, along with our cities, counties, state, and country. May God bless, and may God continue to bless Putnam County. Thank you.